A study out of Northwestern Medicine is challenging current guidelines for lung cancer screenings. After reviewing nearly 1,000 lung cancer patients, researchers found most would not have qualified for screening under the U.S. Preventative Services Task Force's recommendations. They are now recommending the guidelines be expanded to include everyone aged 40 to 85, regardless of smoking history. And joining us now to dig into the findings of this study is the study's author, Dr. Calvin Lung. Doctor, thanks so much for being here with me this morning. First, explain a bit more about the current guidelines for lung cancer screening and who is advised to get screened.
Yeah, well, thank you very much for having me. So the current guidelines really focuses on those who have the highest risk for lung cancer, which is very important. So they're people who have smoked more than 20 pack years, having quit less than 15 years ago, and are aged between 50 and 80. And we know they are the people who are most at risk, but they're not the only people at risk for getting lung cancer.
Yeah, well, you know, as I mentioned to you, at least anecdotally, I feel like I hear more and more about people being diagnosed, more in my age range, with lung cancer who've never smoked before. So regarding your study and the findings, what needs to change?
Yeah, that's a very astute observation, because we're seeing that as well. We are seeing younger people with getting lung cancer. 9 patients in this study they were under the age of 50, so they would not have met the guidelines even by age alone. And a quarter of patients actually never smoked. So these guidelines don't cover any of those patients. And what we need to change is to make sure that everyone who's at risk of getting lung cancer can get screened.
How do you get this message across to people besides talking to me, for instance, on a news program? Because a lot of people who are, 39 might not be thinking, oh, I better go get a lung cancer screening.
Yeah, I think the message is that lung cancer can affect anyone. And we have so much exposures in our environment to different things nowadays that we need to be careful, and we need to destigmatize lung cancer. It's not just a disease of those people who have smoked. It can be anyone.
Now, I know Northwestern Medicine just launched the Lung Health Center to offer free, low-dose treatment, CT scans, etc. Can you tell me more about this program and who's able to get screened through it? So
this program is a new initiative to combat exactly what we've seen, is that anyone who's 21 years of age or older can get screened through this program. And it doesn't only pick up lung-specific problems, it can also pick up heart problems or bone problems, but certainly we want to use the information to help us understand lung cancer a bit better in those people who don't fit the current screening guidelines.
And besides smoking, we've already talked about how it's not just smokers being diagnosed. What are some other key factors that could cause lung cancer?
We know that radon gas, for example, which everyone can be exposed to, it just comes out of the ground. Secondhand smoke, heavy metals, things like asbestos. So all those things can cause lung cancer. But there are also people who can get lung cancer that we don't have any risk factors for. A lot of particularly young Asian women, for example, they're a subset of the population that can get lung cancer, and we don't quite know why.
Oh, that's really curious. I'm sure you're studying that too, or someone is somewhere.
Yes.
All right, so the bottom line is, if in doubt, talk to your primary care physician about whether you should, even if you're younger, if you should get screened.
Absolutely, yeah.
Okay. Dr. Calvin Lung, thank you so much for being here. We really appreciate it. It's important information to get out to the public.